Hastily proposed budget cuts and healthcare changes under a Republican-controlled Congress have queer people worried about their health. And I know conservatives are obsessed with what I do in my private time, but in this one instance, maybe shoving something down my throat isn't the best way to seal the deal. Here are 4 ways the Trump administration plans to stop counting, researching, and treating the most vulnerable queer people in the US. After years of lobbying, we finally saw elderly queer people included in national healthcare surveys in 2014. But Trump's Secretary of Health and Human Services, Tom Price, chose to remove questions about sexual orientation from 2 of his department's surveys aimed at seniors. Because if you really care about a community, kneecap their oldest members first. But seriously, who cares if they're statistically more likely to live alone because a virus ravaged their partners and the government wouldn't let them get married? Trump also wants to cut funding for research that helps all of us. We have reliable data on drugs to prevent and treat HIV because of the National Institutes of Health, specifically through their Office of AIDS Research. But during an early round of spending proposals, Trump proposed cutting the NIH budget by 20%, which could impede the approval process for some of the drugs that matter most to the LGBTQ community. To be fair, Trump has promised to maintain some Bush-era AIDS relief programs, but at the end of the day, Trump and Price are cutting money that was originally allocated for HIV research, prevention, and treatment. Speaking of treatment, let's talk about PrEP. When taken daily as pre-exposure prophylaxis, or PrEP, Truvada is up to 99% effective at preventing the transmission of HIV. The National Institutes of Health sponsored one of the largest PrEP studies in the country, meaning that without their help, we might not have FDA approval for PrEP use today. This is important, particularly because a CDC study shows that increased use of PrEP could prevent up to 185,000 new cases of HIV by 2020. But even if we preserve funding for research, it doesn't matter if the people who need treatment most don't have access to it. HIV disproportionately affects Black and/or Latino communities, who, according to a Department of Health and Human Services survey, are less likely to have access to consistent and affordable healthcare than their white non-Latino counterparts. Fighting for our health means fighting proposed cuts in Medicaid that could further limit those most vulnerable to infection from protecting themselves against HIV. Planned Parenthood. It's not just for pregnant women. Every Republican's favorite punching bag actually provides STI and HIV testing, as well as gender-affirming hormone therapy. In fact, the organization averages 650,000 tested for HIV every year. A fact Mike Pence must know after a 2016 study showed that closing a Planned Parenthood in Scott County, Indiana, helped spur an HIV outbreak. While Republicans claim we spend too much on clinics around the country, the closure of just one Planned Parenthood shows how lives and costs could have been saved if conservatives stopped playing politics with our health. Data shows queer youth are at a disproportionate risk for bullying in schools, and statistically more likely to commit suicide. In 2015 alone, 75% of trans youth reported feeling unsafe in schools. So while old white men in North Carolina and Texas call trans people sexual predators with no evidence, and despite their own party's track record, they're also cutting funding to mental health services that queer people need when they're demonized just for being themselves. By 2020, Republicans want to eliminate the requirement that Medicaid cover mental health services, and cuts to the NIH would likely affect the Mental Health Services Administration. The battle for fair and equitable queer healthcare isn't over. If you are poor, queer, a person of color, or all of the above, this administration's pursuing science and health policies that intend to leave you behind.